White House and the state have both declared monkeypox a public health emergency just ahead of this weekend's North Halstead Market Days Festival.
Eric Rung joins us live with concerns about the big gathering and the outbreak. Eric?
Well, good morning, and this really is a huge event. It stretches from Addison all the way to Belmont, and it has public health officials really getting out a lot of public health warnings ahead of Market Days.
For years, North Halstead Market Days has been one of the largest street fests in Chicago. It is expected to bring in more than 100,000 people to Chicago's premier LGBTQ neighborhood over the weekend. While COVID is still a concern, so is the growing number of monkeypox cases, a virus that has primarily impacted men who have sex with men.
I want to emphasize that there is nothing biologic about this virus that makes it specific to men who have sex with men. However, that is the network where we have been seeing it spread the most here in Chicago and around the world.
Chicago has the most cases of MPV in the state, with close to 460 confirmed cases. It's been detected in 55 of Chicago's 77 neighborhoods. Despite the growing numbers, however, canceling the fest has not been discussed.
Given that we don't see this spread, based on everything we know now, through gathering in bars, through getting together, going to a street party, etc., we do not think that it sends the right message to say we're not doing this at all. We know that abstinence messages tend not to be successful.
Instead, the message public health officials and organizers of Market Days will be getting out on MPV is an educational one.
What you'll be seeing at Market Days is that we are working very closely with the health department and the city of Chicago. We are going to have at our two main entrances, Addison and also at Belmont, information booths that are being manned by the Department of Health, handing out information to people.
That includes information about MPV vaccines. So far, demand has far exceeded supply, but vaccinations is not the whole answer to controlling MPV.
The reason we're talking so much about how to limit risk is that we don't have enough vaccine, but B, even if we had enough vaccine, it takes a couple of weeks for vaccine to kick in. It takes longer than that, and we're still learning about how completely protective the vaccine is.
Monkeypox generally spreads through intimate contact and exchange of bodily fluids.
Now, organizers are still reminding people that COVID is still here, and they're also getting out the message, and one that we have heard over and over again since the beginning of the pandemic, which is if you don't feel good, stay home. We are live in North Halstead this morning. Eric Rung, WGN News.